People, we are back with another yet super fast reading of the newspaper. Young not more prone to COVID in second wave, says government. So the report is from Hindustan Times by Rythma Kaul. The report goes New Delhi. Young people aren't more vulnerable to the second wave of the coronavirus infections in India when compared to the first, said top government medical experts on Monday, citing official hospital data to establish that there were no dramatic shift in the age profile of COVID-19 patients from last year. In an official briefing, Dr. V.K. Paul, member, Health, Niti Aayog, and Dr. Balram Bhargava, Director General of Indian Council of Medical Research, that is ICMR, said data coming from the ground showed that young people contributed roughly the same caseload to the current outbreak as the one that ravaged India last year. They claimed that need for the oxygen and short of breath was seen more among patients in this wave. If we look at age profiles, we will see in if we look at age profiles, we will see in the last year people under 30 years contributed 31% of the cases, and now it is 32%. So essentially, there's no difference. There's no overarching excess of young people becoming COVID positive. The main point we are making is essentially we do not see a shift in the age prevalence of COVID 19 overall in the country, said Paul. Bhargava said only a marginally high proportion of patients were younger and that the average of patients in the first wave was 50 and this wave was 49. From 0 to 19, the difference was 5.8 versus 4.2%. And in 20 to 40 years, the difference was 25% versus 23%. This is marginal difference in this, he said. The data was taken from the National Clinical COVID-19 Registry that ICMR launched in September last year. The data of 9,485 patients from August 2020 to April 2021 was taken for the analysis. The change that we have seen are that oxygen utilization has increased to 54.5% in the second wave from 41.1% that was seen during the first wave last year, and the requirement for ventilation has gone down from 37.3 to 27.8% between the two waves, said Bhargava. Shortness of breath was seen in 47.5% hospitalized positive cases this year as compared to 41.7% last year, he added. The first wave data was taken from September to November 2020 and second wave data between February and April 2021. The good news is that the death profile has not seen much changes. It is 9.6% hospitalized patients in first wave and 9.7% among patients in the second wave, he said. The analysis also found that both the waves, 70% of those hospitalized were above 40. Among 20 to 40 years, 23.7% hospitalizations was seen during the first wave and 25.5% in the second. So essentially, this report says that there is not much difference in all the cases and the hospitalizations and the ventilations. Obviously, here it says the ventilations has gone down, but it says young are not more prone to COVID-19 in the second wave. And this is a report by V.K. Paul, who is a member of Health, Niti Aayog, and Dr. Balram Bhargava, who is the Director General of ICMR. Thank you for listening. Have a nice day.